I want to bring in Democratic Governor of New Jersey, Phil Murphy, now. He joins us, and we want to squeeze you in before we have to go to Biden as well. Governor, thank you for being here. There are millions of folks in New Jersey who rely on either Obamacare or the protections for pre-existing conditions that law provides. What would it mean to the state of New Jersey if it is rolled back, if it is overturned, if the Supreme Court does not rule in favor of this law?
Well, it's devastating. It's devastating in New Jersey as it would be in states across America, although we've recently taken the decision to build our own exchange, take matters into our own hands. But, pre-existing conditions, I think in New Jersey, it's 3 or 3.5 million people out of our 9 million person population. It's seniors, it's access to family planning, drugs. It is the jobs it's created. It's our efforts at the state level to replace the federal premium with a state premium that overwhelmingly helps folks afford health care, and heretofore they have otherwise been unable to afford it. I mean, it's just a whole range of implications that are overwhelming and devastating.
Governor, as you know, we're in the middle of a pandemic, and those who contract COVID-19 might themselves have a pre-existing condition going forward, as we don't know what the long-term effects are for this disease. Some people are experiencing longer-term effects than others. Your state is seeing another surge, and you're shutting down indoor dining and bars over the overnight hours. What is the problem that you're seeing in your state right now?
Yeah, we are definitely back in the soup. And one of the guys who I have to say has been a great advisor to us from day one is Andy Slavitz. I want to give Andy a shout out. So what we're seeing a lot of indoor transmission, a lot of private settings, but we're also seeing not in name, but in substance, restaurants turning into clubs as the night wears on. And so we got to find, and we've taken several steps to stop that. One is eliminating bar seating. Two, asking places to close their indoor activities at 10 p.m. We're fine if you're outdoors. We're fine if you're doing takeout. But those were just becoming spreading events. And we're pleading with people to fight back against the pandemic fatigue. Everybody's got it. Who could blame you? I've got it. But we've got to stay in the fight here. I just spoke with the CEO of Pfizer. This development is real. The vaccine is real. We just got to make sure we bear down until that's broadly available.
That's a great segue to my next question, and I want to play a short soundbite from Health and Human Services Secretary Alex Azar this morning on CBS. Let's listen.
Yeah, so we're working in collaboration with the governors to do this. They will actually make the determinations of who should get the vaccine within their state. We'll make recommendations based on the professional judgment of the CDC, but the governors will be in the driver's seat.
So the governors will be in the driver's seat. He said this morning that it's going to be up to you to decide who gets this vaccine first, who's most in need. What is your plan in New Jersey to make sure that the most vulnerable populations are at the front of the line?
Yeah, I mean, they are prioritized, Katie. They've been that way for testing. They've been that way when we surge any sort of resources, contact tracing. The vulnerable communities, the frontline healthcare and other essential workers have been at the head of the line, and they will be for a vaccine as well. Secretary Azar has been a good partner for us. General Gus Perna was on yesterday going through our distribution plan with the Commissioner of the Department of Health. And it is a plan that is consistent with CDC guidance, but also takes into account the uniqueness of our state, as any state would. I feel very confident that our plan will address the inequities that this virus has unearthed. May not have created them, but it has laid them bare. And the folks who need it the most, especially our vulnerable communities, will get it at the head of the line.
So one more question on that. It's going to be pretty difficult. This vaccine needs 2 doses. It needs to be stored in ultra cold storage. Millions of people are going to need it as quickly as possible. Are you confident that you have all the resources in place, that the government, the federal government has all the resources and logistics in place to ensure that the vaccine itself survives the transport from the federal government, from the CDC and the FDA to the individual states and then to the individual doctors' offices where this vaccine is going to be distributed. Yeah,
I mean, it's exceedingly complex. General Perna, that's his oversight. By the way, he's a Jersey guy. But you've raised all the right questions, Katie. We need the federal government with us. It may be up to us as governors to have a distribution plan and obviously be at the point of attack, but we need the federal government in a big way. As I say, General Perna is overseeing that aspect of it. But there's money, there's logistics. The whole food chain and the distribution process, as you quite rightfully point out, it's 2 jabs. It has to be stored at minus 80 degrees Celsius, et cetera. It is a very complex process, and we need the federal government as robust partners every step of the way.
Do you know what exit he's from?
Oh, I should have. I believe he's from Morris County. So he's a little bit off the beaten path of both the Turnpike and the Parkway.
Okay.
But all right. I'll get that for you next time.
My trick question. Governor Murphy. Governor, thanks so much for joining us today. We always appreciate your time.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.